Think of healthcare in Lee County, you think Lee Health.
Yeah, the man in charge of Lee Health told me in an exclusive interview the hospital system is going to change and its near monopoly will not last forever.
When you walk through the doors of a hospital, you're there for a reason, to say goodbye, to recover. Maybe it's to celebrate life. For Dr. Larry Antonucci, he's at Lee Health to transform healthcare.
We need to be the model for healthcare delivery. We've got all the pieces of the puzzle. What we need to do now is really work.
For most of Antonucci's 40 years at Lee Health, he delivered babies. In 2007, he took on the challenge of administration. 10 years later, Lee Health named him president and CEO. While dealing with the business of healthcare, he told me he never forgets the people who need healthcare.
If you always keep at the center what's going to be best for the patients, what's going to be best for their families, it makes the job easier.
There's not much competition. Is that a good or a bad thing?
It's one of the things that really attracted me to this health system because what we can do as a health system is take ownership of the health care of the community. In a highly competitive environment, sometimes you're focusing more on your competition than you are your patients.
Antonucci told me he expects there to be more competition in the next 5 to 10 years.
We're going to have choice in the community. And our goal is to continue to be the provider of choice, as we've been for over 100 years. And in order to do that, we have to focus on the patient and the family.
Even though he'd been here for decades, the pandemic made Antonucci a household name. He was on TV a lot.
One of the things that I really focused on was to try to be a source of truth for this community. What we learned is that we don't know everything. And I think that, and that was difficult for health systems and for physicians to accept. We were literally changing protocols, if not week to week, day by day. I mean, we had our staff members who were sleeping in their garages because they were afraid that they were going to give the disease to their families, and it was so humbling.
But Antonucci kept up with the changes, both on the virus and the vaccine. Among his current challenges, Florida's new immigration law. Lee Health must ask all patients if they're lawfully present in the United States.
How uncomfortable is it to have to ask a patient for their immigration status?
I think it's important for patients to know that if they need our care, we will be here for them. What their immigration status is will have no effect on how they're treated.
For Antonucci, once a doctor, always a doctor.
Do you miss delivering those babies?
Yeah, I do. I miss delivering the babies, and I miss being in the operating room. Those are the two things I think that brought me the most joy.
Now, I also asked Dr. Antonucci if he could give himself younger advice. What would it be? He said, be open to possibilities, be open to opportunities that you may not have ever imagined. So pretty good advice there, he says, because they are going to be there.